The following content is for informational purposes only and should not be considered medical advice.
Welcome to KC Wellness Talks. I'm Dr. Dawn Ipsen, pharmacist and your host. Join us as we delve into the world of healthcare with local providers, discussing common health concerns many face and exploring ways to overcome them. Whether it's simple tips from home remedies or the latest in technologies and treatments, we've got you covered. Today, I am so excited to introduce you to our guest. This is Lauren Schweizer, nurse practitioner.
Thank you.
Thanks for being here.
Thrilled to be here. Fun.
Yeah, we're going to have a great time today. Let me tell you a little bit about Lauren. Lauren is one of my top favorite prescribers in our area. We have been longtime colleagues, friends, and have worked together for decades now. We get to say that.
We get to say that.
I know. Professionally, Lauren has always been involved in teaching, motivating, empowering women through health and wellness. She began as a labor and delivery nurse and a Lamaze certified childbirth educator. And after 12 years, you went on and got more education yet, a master's prepared certified nurse midwife, and a women's healthcare nurse practitioner. Such an important specialty that we are grateful to have in our community.
A natural evolution.
Right? Initially, your career emphasized on the development of getting really strong clinical skills. And then over time, of course, you found your true passion and talent for connecting, motivating, and educating. Those became the driving force. Then you got to have your second child.
Well, my kids are 10 years apart.
Oh,
so,
gosh.
It's sort of like two separate, times in my life.
Right.
And so it was very much, time to look at what's next.
Right. So then it was time to go back to medicine and went specifically into a doctor-owned OB-GYN practice and doing gynecological and women
Wellness care, yeah. And really timing-wise, that was where my own life sort of evolved. When I was in my 20s and 30s, very much into the birthing and babies because that's what I was doing in my own life. And then, it was just sort of a natural evolution to move on to more wellness and midlife care, and so it was very organic.
You were doing that for a long time and realized that you were evolving and changing and ready for a new direction, I think. Tell me about that.
Well, again, I worked for doctors in a fairly traditional OBGYN clinic, and I was doing a lot of their well woman care, a lot of their prenatal, and just started wanting to get into a little bit more of a natural, more patient-centered kind of care. Plus, I've always been a real natural teacher, and I wanted time, to work with the clients. And so, again, the natural evolution was I needed to be my own boss.
Yeah, big step.
And set, my own timetable for appointments and get a little bit more into a more integrative, naturopathic sort of lean. And that was sort of the impetus to start my own primary care practice.
Wow.
Bothell Women's Health.
Bothell Women's Health, 2010?
Yeah.
Okay.
I mean, basically, you start the process for a year and then you open the doors about 9 months to 12 months later.
Right.
And I wanted to emphasize an integrative approach. And here in the Seattle area, it's so nice because we do have a very strong naturopathic community, naturopathic education. So I started just doing a lot of continuing education with the naturopathic community. And what's so nice about the nurse practitioner is we can expand our scope of practice through continuing education, etc.
Okay.
Worked with a Bastyr trained nutritionist for a while, and she really, opened my eyes. And so the clinic just sort of evolved into that, and women want that kind of care.
Yeah.
I've always been really fascinated with, again, the hormones and wellness care, prevention being, the guiding force. And so that's for almost 12 years, we did the primary care clinic.
And quite busy and vibrant place you had with amazing positivity and energy, and patients love you. And they loved going there to see you. So then COVID hits.
COVID, and that was an eye-opener for everybody.
Right? We learned a lot
Yes.
real quick.
Yes, we did.
Yeah.
and transitioned to a lot of, telehealth with everybody
Right.
else in that same sort of situation. And we did really well for about a year, and then just sort of kind of realized that, what does post-COVID look like? And
Yeah.
we had really pushed all of our resources and our staff and everything. And so the decision was made that we needed to close doors. Plus, it kind of corresponded with, leases and all of those other things that play into it.
Right.
But the reality, now that I look back on that, it really was the reality that I was struggling a little bit, within the system of a single provider, private practice, kind of.
And billing insurance plans at that point, right?
Yes,
And we've
yes.
all heard lots in the news and, the loss of care providers and loss of pharmacies due to insurance plans and the middlemen of them, the PBMs, and how they're squeezing the entire system from all angles.
Right.
And I'm sure you were feeling that squeeze.
Well, exactly. And, the reality, especially in my opinion, in women's care, it's all about education. It's all about building a collaborative relationship. And when you're looking at, especially hormones are a great example. I mean, trying to educate a woman into what is coming, that anticipatory guidance and what's available and what's, the good and the bad and all of the, ins and outs of treating menopause successfully. Well, that in my clinic was an hour-long appointment.
Right.
But
Right.
wasn't getting reimbursed for an hour-long appointment.
Right. But you were still doing that because you felt it. You felt and knew it was what was needed for best care.
Right.
Oh, that's fascinating.
Exactly. And so we did a lot of, sort of creative things to sort of make that happen. But if you're, billing third-party payers, then it's based on a coding system, and your average menopausal counseling appointment is about a 15-minute appointment.
Wow.
So,
Hard to get anything done.
So I blame it on COVID, but the reality is,
it was an evolution. It was the timing.
It was timing. Yeah.
So fast forward us.
Yeah.
Tell me about New Horizon Hormone, your practice now.
Yeah. So this was, again, my rebirth.
Yes. The reinventing of perfection. Yes.
And really, I have to thank COVID because, we established that telehealth model in the clinic. And so, I was doing most of my appointments. We were still going into the clinic. We still, had that routine, but pretty much everything was done remote. And so it established that norm. And I realized I'm doing really well doing this one-on-one with women, and because we did a Zoom type model, it was very organic, and for the most part, again, when you're doing hormones, you're doing, and during COVID there was a lot of mental health and a lot of, it really was the majority of counseling,
Right.
and checking in and sort of triaging and reassurance, and the telehealth environment really lent itself well to that. And so, again, I was during about a 6-month period when we knew we were closing the clinic and we were just making all of that happen. It just started, working out in my brain. I'm not quite ready to be done.
Right.
And what does this look like? And, we already have this model. So why can't we transition it? And at the time I was doing full scope primary care.
Okay, right.
With
all pieces of
Right.
wellness for women.
Correct.
But all avenues of it.
Correct.
Okay.
But because my love and my emphasis has always been a more naturopathic, integrative approach to hormones, obviously bioidentical hormones were a big part of my practice. Right. Also an integrative approach to thyroid.
Okay, yeah.
And that. So a lot of the women that came into the clinic, yes, we did primary care, but a big focus on hormones and, menstruation and, gynecological kind of related stuff. So anyway, it was just a natural evolution. So now we're 3 years post that, and it was a very easy transition. Really, there was no time,
Right.
We locked the door and then
And just showed up on the screen from
That's
a
right.
different background.
That's right. My
Yeah.
computer went from clinic to home,
Yeah.
and now I have a designated space at home. And the funny thing was, at the same time, my husband was at home working
Yes.
remote, and my adult son was working through university at home. So we all three had our separate little spaces.
Oh my
and,
gosh.
But
Yeah.
it worked out well. So
That is wonderful. Yeah, so it's been a great transition and on to new things. And let's see, that has been, is it 4 years now?
well, yeah. I mean,
Essentially.
yeah.
That's wonderful. Okay, well, as a special guest, I have a very important question to get us started.
Okay.
So what coffee mug did you bring with you today? Tell me about your mug.
So I brought this cup, and it's not so much that it's the motto that's on
Yeah.
it, but just in concept. I wear a lot of motto shirts. I have incentive hats,
Right.
coffee cups, and it's kind of just been this sort of fun way to set my intention.
Right.
You know.
And for the viewers who are listening to us today, it says on it,
sorry.
enjoy the
The
journey.
journey.
And it's this beautiful white coffee mug with this, I love that color of blue
Yeah,
that's
it's
on the
very pretty.
inside. It's very calming.
And it
beautiful.
comes with a set of other equally inspiring.
Really?
So.
Ah, so you get to decide what your
That's right.
saying is for the day, what your mantra is for the day.
That's right.
That's
And
awesome.
I thought about maybe wearing one of my T-shirts and a
Uh-huh.
hat, but I
Yeah.
thought that might be too
held
much.
back today.
Yeah.
Yeah.
A
Okay.
little bit,
Yeah. Well, my mug, of course, I have to have a special mug. This one says, "My chickens think I'm amazing," and some of you may know it has pictures of crazy chickens. I am
You are
a
that chicken lady.
proclaimed chicken lady, and I do love my hens. And to me, it's therapy in the sense of being out in nature and dirt therapy and digging around and playing with my chickens. So it's a cup that makes
It's
me
your happy
happy
time.
too. It's my happy mug today. Yeah. Well, thank you for sharing that with us today. So yeah, it's great to have you as a guest. We've talked about this for a long time of you and I should do this and that we'll have a good time doing it. We've worked together a long time. Let's talk a bit about your approach now. I mean, you've evolved a lot over your career, and now you see women via telehealth, and you specialize in hormone replacement and thyroid replacement and therapies. Who are the patients that you're seeing? What are some of the important things that you think our listeners would find interesting as far as relating to maybe they know somebody or themselves are struggling as well?
Well, because I sort of specialize in what we call a bioidentical hormone, I think a lot of my clients who haven't followed me from Bothell Women's Health
Right.
Are somebody who's really saying, I'm motivated to look at bioidenticals. Maybe I don't exactly know what they are, but I've heard your name, I've been recommended. And that's usually, occasionally I'm getting women that are premenopausal, but at this point, I think just because of the reputation and everything,
Right.
Probably our standard client is either peri-menopausal, going through it. And then some are coming saying, I've, gone to my more traditional classic Western provider and have not been happy with options and what else is out there. So a lot of it is education and teaching. And that's why, again, my standard menopausal counseling initial appointment is 60 to 90 minutes.
Okay. Wow.
And we just start from scratch.
Okay.
Because it's just always been a little bit of a sadness for me and overwhelming how little the average woman knows.
Okay.
About what is menopause and how does it evolve and what are those, classic symptoms and how can I treat it?
Okay.
It's not uncommon to have a woman come in who has stopped menstruating, but yet she's been having symptoms for 5, 7, even sometimes 10 years. And, I think to myself, boy, we really should have, communicated, or she could have had care at that earlier premenopausal point that's sometimes even late 30s, early 40s. And there's just a lot that we can do to just help that whole process. If nothing else, just educating. What you're experiencing is normal, and you can do, and it's not just hormones, it's diet, lifestyle, herbal botanicals. There's so many things that we can do, and just say, you're normal.
Right.
Yeah.
So let's back up on that
Yeah.
a tiny bit, because you're right. I think most women probably know that you quit having your period, that's menopause. But can you maybe share with us just a few of those more subtle symptoms that when you think back or look back, you're like, oh, that was it too, that maybe you're earlier before that full-on loss of menarche? What are some of the telltales that are interesting?
Well, I think we talk a lot about estrogen. And
Okay.
we talk a lot about, when the ovaries stop working. But that whole lead up time, that peri or the around time,
Okay.
is really, I always say, it's your ovaries trying so hard to do the job, but it's just kind of losing some of its oomph. And really the hormone that starts to ebb first is actually the progesterone.
Okay, progesterone.
And progesterone also being tied into ovulation.
Right.
So it's not uncommon for women to continue to have menstrual periods, but yet maybe they're not ovulating. And so then if you're not ovulating, you're failing to produce that little cyst that forms in the ovary, which then produces a progesterone. So this phenomena of estrogen dominance and some progesterone deficiency is a very, very common sort of perimenopausal kind of presentation. So even as early as 35, but more commonly into early 40s, women will start noticing heavier periods, basically an exaggeration of PMS.
Okay.
So when we're, in our younger years and reproductive, for most women, not all, but most, PMS or premenstrual syndrome is about a 1 to 2 day event.
Okay.
Right? And it signifies when the body says there's no pregnancy here, so I'm going to, get rid of that little cyst in the ovary. It's going to shrivel up, the progesterone drops, and that's the signal for the body to have a period. Well, that 1 to 2 days when the estrogen remains high and the progesterone drops, what the woman is looking at is just that estrogen.
Okay.
Estrogen being stimulatory in nature, then for most women who have PMS, it's some irritability, it's bloating, it's, that sort of, I don't feel great, etc. But then the period comes and you feel okay.
Right.
But when you take that phenomena of that premenstrual or preparatory period, basically what perimenopause is then you're elongating that somewhat disbalance, because we're failing to produce enough progesterone, or if we don't ovulate, then the progesterone can be, more significantly deficient.
Right.
And so we're now in an estrogen dominant state, not just for a couple days, but sometimes 1 week, 2 weeks, etc.
Right. Big chunk of the month, essentially.
Right.
Yeah.
And so women, again, because estrogen is stimulatory, it's continuing to stimulate that lining. So heavy periods, more crampy. We talk about sometimes the floodgate periods that can happen, in our late 30s and early 40s.
Yeah.
But really, we can treat that very, very successfully with just, looking at, is this an estrogen dominance situation, and can we then balance those hormones?
Right.
Progesterone's the stop sign.
Right.
Right?
Yep. Definitely so.
Progesterone's job is to hold the lining.
Right.
Right? So by doing a little, sometimes progesterone supplementation, or again working with herbal botanicals, we can really sort of remind the body and get it back into a cyclical, sort of state. And it's pretty easy, sometimes. And it's, and once we get that routine down, or then that woman could potentially be good to go for the next 5-7 years.
So awesome.
Before then that sort of next phase of the menopause, where we actually start getting some estrogen deficiency.
Right. Okay. Let's take a second too, and just, if you don't mind, I know you and I know it because we talk it all day long. How do you describe what bioidentical hormones are to your patients when they're inquiring and wanting to know more about what does that mean?
Right. Great question. So when we talk about hormones, most women, even most providers, most literature that's out there is really talking about a synthetic hormone.
Okay.
Synthetic hormones are man-made molecules that are produced in the lab, and they're a little bit by design meant to be different than the molecule that we produce in the body.
Right. Makes
And
them so they can be patented, makes them so they can be mass produced in
correct.
pharmaceutical
and
companies.
some of it is based on our laws.
Yep.
Okay.
Yep.
So if a molecule is created in the lab, then that company can literally own it and patent it. And yes, they need to then do a bunch of testing that then implies and shows that it's safe, and the FDA then regulates it. However, by design, like I said, it's meant to be a different molecule. Okay?
Right.
So it plugs into the receptors in the body, but the body still says, that's not my molecule. Okay?
Right.
And we know that just like a drug, there are going to be potential side effects as the body identifies this molecule and needs to metabolize it and eliminate it from the body.
Okay.
A bioidentical is still technically produced in a lab, right?
Right,
We take natural plant-based molecules and we
Yeah.
manipulate them somewhat.
Yeah.
But the end result is under a microscope, it's the exact same molecule as the body produces.
Right.
So by law, if a molecule is produced in nature, no one gets to own it nor patent it.
Right.
Okay, and that seems good, because you can say, well, this feels natural. I'm putting something in my body that's natural. My body knows that this is my molecule, and hello, estradiol, and
Right.
However, it can pose challenges professionally and from the perspective of the pharmaceutical pharmacy dispensing, because if a molecule is not owned and patented, then no one gets to benefit really from the ownership of that molecule.
Right. There's no profit to be had. There's no
Correct.
mass marketing. There's lots of money out to get it to market, but
Right.
no possibility of turning a profit.
Correct. Right.
Yeah.
It's an ingredient.
Right.
Right.
Yeah.
And so because of that, that's one of the challenges. Now, there is really good literature and research on the safety of the bioidenticals. But what's challenging is when we live in a society as we do in the United States, when multi-million-dollar research is being done on the synthetics to technically prove that they are, going to do what they say that they do and that they're safe. But when somebody doesn't glean any monetary benefit from a bioidentical molecule, there's no one that wants to stand up and say, I'm going to do a comparable multi-million-dollar research project to
Right.
compare it to a synthetic.
Yep.
And so then it's easier for our insurance companies, even the FDA, to say, well, the research isn't comparable,
Right.
right? And so what we then have to understand is that there is research out there, and even our National Institute of Health is doing research, and there's a lot of educational based in research. There's a lot of education, based companies that do it, and internationally, there's huge research.
Lots more out of Asia and Europe.
Correct.
Yes.
Because in many international countries, there's a lot of focus and priority in a more natural approach to medicine.
Yep.
Right?
Very
and
true.
so they're very motivated to do the research. So I can honestly say to my clients that a bioidentical, has been shown to be very safe, and in a lot of cases, clients tolerate it better. They have better outcome. They're statistically more likely to, remain on the product because it's working well for them, as opposed to the synthetics, which are going to have a little bit more side effects potential, and again, statistically, more women are off of them sooner.
Wow. So you've
with the
seen that in clinical practice then?
For sure.
Okay.
For sure. Yeah.
Fascinating.
And there's that whole gray zone of, birth control pills are a classic example, right?
Right.
Birth control pills are synthetics.
Yeah.
And I'm not saying that it's not a good product that has done wonders, right?
Yeah.
But there's a lot of women out there who don't feel good on those synthetic hormones,
Right.
And they have to weigh the pros and cons of, is the benefit outweighing the negative potential side effects that I'm feeling?
Right.
And
And
there's
the need.
and the need.
Right.
Correct.
If
Right.
you're not planning to conceive, then something must be done to
Right.
help that.
Right.
Right.
And birth control pills are a very, very common clinical treatment course, especially in the perimenopause. You know,
Right. They are.
right?
Yep.
Oh, your periods are a little too heavy or they're more frequent, you're having some irregularity, let's put you on a birth control pill. You know, and again, if nothing else, you know, one of the main complaints of birth control pills is a reduction in libido
Yep. And I've also heard weight gain.
and weight gain.
Yeah. Yeah, but the libido is huge.
It's huge, right? You know, and again, that's if you can offer a woman an alternative that's not going to have that side effect profile and do it in a more natural way where we're enhancing the normalcy of the menstrual cycle,
Right.
that makes sense to a lot of women.
Right. Yeah, that does make a lot of sense. So we've talked quite a bit about perimenopause and primarily talked mostly progesterone so far. And just so the listeners are aware, you know, what Lauren is sharing with us is primarily compounded progesterone, although there are a couple bioidentical. You can get progesterone 100 to 200 milligram in peanut oil capsules. And that works for some women, but I see in the compounding pharmacy realm that those doses, especially in perimenopause, are likely too high. And or sometimes women tend to feel better or do better on a cream form of it versus the oral capsule form.
Right.
Is that kind of...
Well, compounding pharmacies just lend themselves to the beauty of an individualized approach to hormone care, where, you know, again, getting back to the legality of it and the money and the profitability within the drug companies, etc. There are some bioidentical options pharmaceutically, but they're very limited.
Yes.
And it's, you know, basically they're saying that there's enough of a market here,
Yeah.
you know, but we're going to, you know, reduce the availability and
Right.
and so
Couple presentations.
exactly.
However backwarded at the moment, but
Right.
you know.
And so,
Yeah.
you know, I'm not going to say that I don't have a client that I can say, you know,
Yep.
there are some pharmaceutical options
Yep.
if you want to run insurance for sure, or you know, this feels more comfortable to you.
Yep.
I can say these are bioidentical, and in the case of estrogen, there's benefits doing it transdermally, which we can talk about if need be. But that we can find that through a patch, for instance. But you're right, very limited dosing and fairly high copay because
Okay.
you know
Yeah, right.
it's not one of those highly available bulk products.
Right.
So the compounder in my mind is like the perfect option because we can literally make what this particular individual needs.
Right.
And in the case of progesterone, I mean, when we look at the normal menstrual cycle, progesterone is adjusting on a daily basis, right?
Even by the hour sometimes.
Exactly, right?
Such a moment in time.
Right, because progesterone, again, being the stop sign, being the balance, being the calming force to estrogen stimulation,
Right.
it adjusts as the cycle progresses. And so having some mechanism like a cream or even a low dose oral,
Right.
I've got many of my clients who are just literally watching their body, watching the symptoms,
Yeah.
and saying, do I feel estrogen dominant today? Do I have breast tenderness? Do I have bloating? Do I, you know, and that's going to then help them to dose appropriately,
Ooh.
right?
This is such a great topic. And you are by far the best provider I know in the area of helping women do kind of what we've talked about as intuitive dosing. Could you talk a moment about that, what that means, and how you kind of work through that with a woman?
Yeah. Well, I mean, all women, whether they acknowledge it or not, have a hormonal language.
Yeah.
You know, and we talk about that when I first see a client because it's like, oh, you're right, I do. But basically what it is from adolescence on, we women get up in the morning and we ask ourselves, how do I feel today? Right? Do I feel hormonal? You know, literally I say, oh, I feel a little, you know,
Right.
breast tenderness, or I feel like I'm holding water. Where am I in my cycle? Oh, my period's going to come in a week or so.
Right.
Oh, that's why I feel this way.
Yeah.
Oh, I'm a little more emotional today. Oh, hormones.
Yeah.
So we've got the language, we know it,
Uh-huh.
but why? That's your body talking to you.
Right.
And so if we just zone in on what do hormones look like when they're maybe a little low
Okay.
or a little high,
Okay.
and what is that sweet spot that we all say, I feel really good today.
Today is the
right?
day.
Today's my day. Exactly.
We hit the bullseye.
And so for mostly, I just say, think about it, focus on it,
Yeah.
you know, and I literally say, okay, I'm going to do menstruation 101 for you.
Okay.
Okay, and we look at, you know, when a woman has a period and everything kind of gets washed away, most women feel pretty good. They feel, you know, emotionally they feel good. Everything feels pretty good. And when we look at estrogen, estrogen is stimulatory, right? So it's stimulating the body, it's activating the brain. We feel very, you know, motivated and good. Energy tends to be good. Brain function is good. So in those first 1 to 2 days of the cycle, that's estrogen building.
Okay.
And then when we have ovulation at mid-cycle, right, that egg pops,
Yep.
and that little corpus luteal cyst in the ovary forms, and that's where the progesterone comes. So here's this estrogen building, and then here comes that progesterone to balance.
To meet it.
Okay, so if we don't address that progesterone, then the estrogen, excuse me, just wants to keep building.
I see.
Okay? So what I tell women is, think estrogen is always stimulatory, okay? And so when you check in with your body regarding estrogen, do I feel tired, fatigued, brain fog? Am I having temperature instability? You know, do I feel dry? You
Right.
know, again,
Hair, skin.
exactly. Am I not lubricating?
Vagina,
You know,
yeah.
etc. That's estrogen deficiency.
Okay.
Okay. Too much estrogen, and again, for most women, it's going to be, you know, the breast tenderness, the bloating, the irritability. It's PMS.
Uh-huh.
Okay.
Okay.
And so that's a good sort of gauge. And then with the progesterone, like I said, progesterone is the calming, progesterone is the stop sign. And so what I do is I teach women to check in with those,
Okay.
and then we create a mechanism, which in the perimenopause, it's usually a combination of herbal botanicals and probably a bioidentical progesterone, either in a cream or a low-dose capsule.
Okay. Yep.
And then, you know, some women are doing a progesterone 2 weeks on, 2 weeks off.
Cycling through, so they're
Cycling.
having those periods.
Right, we're mimicking how the body would want to do it.
Right.
But what is really so exciting is literally on day 14 when they start their progesterone, they could be at a very low dose.
Right.
And then by the time they get to day 26, before they start bleeding, they could be, you know, twice that, quadruple that,
Right.
because they're adjusting based on their symptoms of estrogen.
Very cool.
Yeah.
And how long do you feel on average it takes a woman under your care to kind of go from starting the hormones to doing this intuitive dosing to figuring it out, kind of getting a pattern down? Is this months or years or days or?
So really my routine, you know, and again, it's sometimes a little different when a woman's still having periods.
Yes.
Okay, we have to appreciate the fact that her ovaries want to do the job.
Right. They want to get kick-started back to the world.
And everything affects our hormones, right? So, you know, your diet, your exercise, the stress, you know, how well you're sleeping. I mean, even something as simple as, you know, I always laugh that, you know, my adult daughter came back in the house and all of a sudden my periods started up and I haven't had a period for 6 months, you know, and then they're sinking. So we have to appreciate that perimenopause can be somewhat challenging.
Right.
Right? But for the most part, I do a consult appointment, again, an hour to 90 minutes. We set up a routine.
Yeah.
And I'm literally saying we're going to create an experiment for you.
Yep.
Okay.
Here's your parameters.
Here's your parameters. And so we create a very safe, reasonable parameter based on, you know, her wants, sensibility, what do you think you can do here, what seems to make sense to you. Sometimes it's, let's start with some herbal botanicals, you know.
Right. Slow and steady.
Some Vitex and Chase Tree Berry, maybe some Dim. And then that person, let's check in 3 months.
Okay.
Right? We usually say 3-month period is going to be a good time frame to make an influence on a cycle.
Right.
But often, if there's a hormone involved, then again, it's okay, you go play. you
Yeah,
know, and
right.
you're listening to your body. And when I do this, how do I feel? And what's the results? And is this the desired
Right.
effect? And then we check back in. We do follow up in somewhere around 12 weeks.
Okay.
How you doing? How you feeling? What did you figure out? Okay. And a lot of times it's, this is great, and I'm dosing my progesterone 50 milligrams
Okay.
at the beginning, at the mid-cycle, and then I'm working up to 100 to 150 milligrams. Then once my bleeding starts, I discontinue the progesterone. Then
Right.
I go another 2 weeks without.
Right.
And that's doable. So
Very
at
cool.
that point, okay, this is your routine. And do you like the cream? Do you
Okay.
like the oral?
Right.
We do know that when we dose progesterone orally, because it then, processes in the liver, we get a little bit more of the calming effect
Right.
that can come with progesterone.
to help
With
augment sleep,
and calming.
Yep. Anxiety.
For sure,
Yeah.
because again, estrogen being stimulating,
Stimulatory.
if we are estrogen dominant, we
Right.
will lean towards anxiety and irritability.
Right.
And I mean, progesterone can be a game changer.
Absolutely.
And what's sad is a lot of these women are going to, again, maybe more traditional primary care Western medicine, and they're being put on antidepressants.
Oh, yeah.
And being treated more from the approach of general anxiety
Yep.
disorder
Yep.
and depression, and you start with some progesterone, and like
Yeah.
I said, it can be a game changer.
For sure.
So that's the perimenopause, but the reality is I do the same thing with menopause,
Very cool.
right?
Yeah.
And a lot of my clients, if I start with them early on, it's literally I'm saying, okay, this is your routine, keep it up, but if you start getting some temperature instability, right?
Vasomotor symptoms.
Vasomotor symptoms,
Yep. Hot
right.
flashes, night sweats.
Yes. And also I say watch for vaginal dryness.
Oh, yes.
Because
Yes.
that's sometimes the early sort of onset.
One of the first symptoms,
yes,
right?
Of some, And again, there's some really easy fixes for that. But the average woman sometimes doesn't know to ask or to
Right.
understand, right?
Or that it's connected.
Right. And are the cells that line the vagina and the cells that line the urethra, right? All of those cells are very estrogen dependent. Also, testosterone receptors there.
Right.
So anyway, I have them watch for that. And then they say, oh, I'm starting to have the hot flashes. So then we'll have an appointment, and then we talk about the estrogen. If a woman comes in postmenopausal, where again, her primary focus at that point for most women is I'm having hot flashes and sweats.
They know it.
Yeah.
There's no doubt in their mind what's going on. This is menopause.
Right.
Yep.
Right.
For sure.
I'm miserable, I'm uncomfortable.
Yep.
And in some cases, it's affecting the quality of their life, their
Oh, yes.
job.
Yes.
I always think about my dental hygienist, my dentist, my, providers, my, people that are wearing, suits for work, and
all
it's
the
just-
personal protective equipments and
yeah,
yes.
yeah, crazy.
Oh gosh.
So in this case, again, we sort of do the same thing. Let's teach your body, and teach the women
Yeah.
what is your body trying to do, and it's used to having higher levels of these hormones,
Right.
and all of a sudden it's not getting those.
Right.
Okay? So it technically is a deficiency, stage or a deficiency episode. And so what we're doing is just to say, let's give your body some of these hormones.
Put back what used to be there in nature that you used to create all on your own.
Correct.
Yeah.
Right. But it's not for me to say, this is your dose.
Right.
Right? This is what's going to make it all better. But what I can say is, I've got these wonderful tools. They're bioidentical, completely natural, and we can deliver them in a way that allows you to titrate and play with it a little bit and figure out what your best dosing is.
Right.
Right. And one of the things that I often will tell women is don't be afraid of hormones.
Right.
Right.
Okay.
We're
Tell me
producing,
more. Yeah.
well, we're producing hormones in our body
All day long.
all day long. And when you look at, I mean, the classic is one day you're pregnant and your hormones are crazy high.
Oh, gosh,
And
yeah.
then you have a baby and then they're, you know, super low. It doesn't
Yeah.
mean that you feel great.
Yeah.
Right.
It's a big adjustment.
Right.
Yeah.
But your body is used to having fluctuations, and your
Yeah.
body is going to talk to you when it's happy and maybe when it's not happy, right? So if we tune into that, and I then give you the tools that you need, you really just be curious, right? At
Right.
this particular dose, how do I feel? How am I working? How is my day going, right?
Yeah.
And
right.
if a woman's having hot flashes, it's fairly easy because that's your primary goal,
Right.
right?
And it's easy to measure. It's quantifiable.
Exactly.
Right.
Right?
Yeah.
So for most of my clients, from that perspective, it's let's get rid of these hot flashes. You should be temperature stable,
Right.
right? And that's the goal.
Right.
But again, I love working with the creams
Okay.
because in my opinion, at that stage in the game, especially with estrogen, having a cream that's being dispensed via a little syringe that's very easy to manipulate, it's her being empowered to say, I get to figure out what my best dose is.
Right.
Not somebody
Yep.
telling me, or not somebody saying, well,
Prescribed.
right, we looked
Yeah.
at your labs and this
Right, the
is
labs,
where
yeah.
you want to, you know, be.
Yeah.
So often what I do is I start them on the estrogen. I usually work with a biased because I do appreciate that the estriol balances and has some benefits, and I like, you know, the combination of the two estrogens.
Right.
And I give them, again, I say, I'm going to call the compounding pharmacy, and they're going to call you,
Yep.
and you're going to get a little baggie full of syringes,
Yep.
and then they have a very defined parameter of how to work with this. We set up a routine. I call it the titration method,
Yep.
and we start very low dose, and we talk about how, you know, when you deliver that cream, it's going to absorb, you know, directly. You know, the hormone receptors are in our fat cells under our skin.
Yes.
So it's very intuitive.
Right.
And then you stay at a dose for about 3 days. You watch and you watch. How do I feel? Chart your hot flashes. And then you go up a little bit.
Right.
Right?
Yeah.
So I like the you know, the small amount of like a 0.5 milliliters, half a gram.
Right.
Because it's very doable. It's not overwhelming. And I always say this is your base amount, and we start here, and then you go up by little 0.1 every 3 days or so.
Right.
And literally, they then just find
The magic.
the magic.
The magic.
Yeah.
So just to kind of catch people up, what Lauren is referring to, just to back it up a tiny bit, of biased. Biased
Yes.
is, it's a coined name, I guess, really. That means bi, meaning two, estrogen. So it's a mixture of both estriol and estradiol. And, you know, I would say all healthcare providers out there know exactly what estradiol is, because it can be manufactured synthetic, or not synthetically, but it is bioidentical, but it is manufactured in tablets and creams and patches and things like that. But like Lauren was mentioning, and a lot of functional medicine providers prefer this and appreciate having the estriol in with it. And estriol is one of the many estrogens that the female body produces on its own, and there's been shown to be potential for some health benefits to having that estrogen in with it, for better balance, possible reduced risks, getting more benefit out of lower doses of estradiol, making it a little bit more effective without raising that dose. And so primarily the estrogens, it's pretty important that they're primarily not taken orally, that we do these in topicals or transdermals or patches or things of that nature. It's a way to minimize risk even further of changes of clotting factor and things of that nature. So Lauren, generally, like many providers, prefer it for compounding pharmacy. We make it in a cream, and these creams can be dispensed in syringes that are pre-filled, that then the patient, the woman, learns how to measure out that dose, and gives a lot of control on how much is dispensed. So I just wanted to take a second.
Right.
And make sure our listeners were following along with that. So
And you know, the reality is that it can be a little surprising to my clients that I'm giving them so much control.
Yes.
You know,
I hear that a lot, actually. They're
Yeah.
like, how do I know? I'm like, trust the process. Trust your body.
Yeah.
You can do this.
Right.
Yeah.
And that's it. You know, I reassure them that, you know, we are dosing, actually we're starting very low, and sometimes I'll even do the math for them.
Yes.
You know, and show you that I am literally, you know, starting you at the lowest dose pharmaceutical available.
Yes.
And again, it's a very slow titration. But what I find is then these women understand what it feels to be hormonally balanced, right? And, you know, I basically, again, we're talking you through, hormones talk to us when they're out of balance.
Yes.
Okay? When we're in balance, we just feel normal.
Right.
Right? And one of the best things that my clients can tell me when we come back for maintenance once a year is, well, I think they're working. I feel fine, you know, and I don't know if they're, you know, I don't know if I even need hormones anymore.
Oh, I know, right?
Right?
Yeah.
And I go, nope, that means that, you know.
Well, your body didn't start producing them again overnight, so
Right.
we might want to just.
But I reassure them that that means that you're dosing appropriately.
You got it right.
Yeah, you've got it right, because
That's
your
so
body isn't saying, hey, listen to me,
Right.
something is out of balance here.
Yes.
And again, it's really works very, very well. And then I have progesterone at the same time. So they're doing estrogen generally in the morning. I have them do progesterone at night, just to separate, where estrogen is all about getting rid of the hot flashes and the night sweats, again, just making the body feel more, you know, moist and productive and all of the above.
Right.
And the other beautiful, beautiful thing about the creams is it's really like several products in one, right? Because I understand that probably 60+% of my clients are really having struggles with the vaginal dryness, lack of lubrication, pain with intercourse. And I just have them say, put that little dollop in your hand, take a little bit on your finger, and rub it right into that vulvar tissue. And those tissues are just going to soak up that estrogen. It's a good application site because there's good blood flow down there. Plus, it's going to help with bladder control. Right?
Yes.
Because those cells that line the urethra are also hormone dependent. So if they thin and lose their integrity, we're going to lose the integrity of that sphincter muscle. So I just remind them, you know, for most women, once or twice a week.
Yeah.
But here, you don't have to have another product.
A vaginal product specifically that they can use the same. Yeah.
And so then they're also working with the progesterone, and progesterone's about calming and sleep. And yes, we talk to them about, you know, if you have a uterus, then you need to be on the progesterone to protect that uterine lining. And so that's at that consult appointment, they get the routine and they get their hormones, right?
Wow.
So then I have them off working. And generally with that, you know, I don't, unlike the perimenopause, I usually give them a shorter period of time because it's a little bit more of a defined goal.
Right.
So probably about 6-8 weeks, sometimes shorter. And then we get together, and then it's like, what did you find out?
Okay.
And the hope is, I'm not saying all, but most of my clients say, I am temperature stable, I don't have any adverse symptoms, I'm feeling really good. And so then we say, okay, are we ready to combine?
Okay, into one product.
Into one product. And that's, again, the beauty of the compounding pharmacy. That option is not available pharmaceutically.
That's true.
Right.
And definitely not in a personalized medicine form.
Correct, right. From the, you know, progesterone is only available, you know, as an oral, so you would need maybe a patch with an oral progesterone, but we can literally say, I'm going to take that individualized dose of estrogen and that individualized dose of progesterone, and we're going to put it together in one cream, and then we make it easy for the client. So some still like the syringes, and so we keep them in the syringes. I'd say probably 50% will go to then a single dispensing, you know,
Clicker
pump or
device or
clicker
pump.
device.
Yep.
Exactly.
Exactly.
And it's so interesting is I've got some clients who can dose once a day and they feel great. I have other clients who just feel more balanced doing it twice a day.
Yeah.
You know, and it just again lends itself to a real individualized approach.
Very cool.
So
Yeah. This is really wonderful. Yeah.
And then, we can also knock on the door of a little, testosterone or some of those other hormones.
Right.
But I always say you got to get the two primary hormones balanced first.
Wonderful.
Right? And then, so again, from the average client, it's a consult, it's a follow-up, and then you're good to go for a year.
That's so incredible, so empowering, and a lot of information. That's great. We're getting low on time,
Okay.
but if you had a closing thought or something that you think would be beneficial for listeners to know from your perspective, anything you want to leave them with?
It's just a continuation of listen to your body.
Listen to your body. Get educated.
Get educated, but from hormones and even, thyroid, adrenals, all of the glandulars, those are ways that we meet and adjust to our environment, right? That's kind of their jobs in the big scheme of things. And so when we're working with the glandulars and hormones in general, your body is where the wisdom is.
That's amazing.
Yeah.
Now, tell listeners how to best find you or connect with you or learn more about you and your practice.
Yeah, so New Horizon Hormones, probably the best thing is just to go on the website.
Okay.
And my lovely Bree, who was my receptionist at Bothell Women's Health, came with me, and she is basically, the support half. So she does all of the setup, and you get a new client packet. Again, we also do a more naturopathic, functional kind of approach to thyroid. Some of my clients, we do both. We also do a wellness consult,
right.
where we're just finding that a lot of our clients, especially from Bothell Women's Health, you've got your primary care, they're good, but you
Just need a little extra.
You get a 10-minute appointment, 15-minute appointment, labs are done, and then we really don't get a lot of education with, herbal botanicals, diet, lifestyle, screening labs. What do these mean?
I'll have to have you back again. We'll have to do another one of these on that.
So we've been offering that, and that's been really, a success, and we can incorporate that into, the hormone stuff too.
Awesome. So. A gal with many, many great traits and gifts for our community. So
thank you.
Thank you so much for coming on today. I really appreciate it. And thank you for telling the audience all this.
It's obviously my passion.
I know, the education piece.
Okay, it's time to be done.
No, you're doing great. It's so fun to have you here. Yeah. But that is all for today's episode. I want to thank you so much for listening. If you enjoyed what you heard, please subscribe to our channel. Give us a like, share it with your friends. Stay tuned for more insightful discussions and guests on KC Wellness Talks. Until next time, take care.